Just a quick line about me. My name is Shadan Mirza. I'm a director at Samhita Collective Good Foundation. Samhita Collective Good Foundation was set up by Mr. Enes Nandatur, a co-founder of Infosys, and is run currently by Ms. Priya Nayak. She's the CEO of Samhita Collective Good Foundation, and we work as a social catalyst to improve lives wherever possible. But over to Torsha Das Gupta, my colleague from Samhita Collective Foundation, and she would take you through the first part of the expression of interest. Torsha, over to you.
Thank you so much, Adan. Thank you everyone for joining us. I think we are grateful to you for taking our time and sitting with us through the next 1 hour. So I'm going to straight dive into the program itself. Let's move to the next slide. So what this program is actually about is that we are inviting expressions of interest from Indian non-profit organizations. So that's a pretty hard criteria. If you are a for-profit organization, unfortunately, this grant cycle will not be able to entertain you. But if you have any kind of innovative, community-rooted approach, which is creating lasting changes for underserved populations, you're welcome to apply for this. Quickly going through some numbers, this entire grant pool that we have is 50 crores, which is going to be spread across 3 years. If you get successful in the EOI stage and you're invited to apply for, if you're invited to submit a full proposal, then we will require a budget from you for each year. And also the dispersal of the grant will happen in annual tranches. Um, for each of the portfolio priorities that we have, there is a separate cap. We will walk you through that. And there are two stages to apply. One is an expression of interest, which has already been floated. It is a Google form. We'll assess that. And if you are successful, we will reach out to you for a full proposal. There's a template for that as well. So we would request you to adhere to that template. For this grant cycle, we have 4 priority portfolios, which is health. It includes mental health. Second is elderly care. Third is climate and vulnerable livelihoods. And we also have a smaller bucket called like emerging opportunities, which will cover animal welfare and arts and culture. Now, these are pretty broad, but we have identified very specific sub themes within that. So, if your organization is working across any of those, we would request you to highlight that and prominently show what you're working across those areas. Moving to health, the maximum grant size is 3 crores, which is across all 3 years, across the entire grant period. So if you're applying for a 3-year grant, your maximum can be 3 crores. If you are applying for 2 years, it can still be 3 crores. But for across the entire grant period, the maximum ask that you can have is 3 crores. However, we will be evaluating for value of money and see if the ask is justified or not. Moving to the sub themes that we have. First is if you're building or strengthening any kind of basic health infrastructure that brings quality care close to remote populations, hard to reach populations, tribal populations, we would encourage you to apply. So, an organization, say, who is setting up or running primary health clinics where the nearest government clinic is hours away, we are looking for organizations like that. Second, if you have a nurse-led or community health worker-led primary care model. So if you're, instead of waiting for doctors, if you're training ASHA workers or any other community health worker to diagnose common illnesses, manage maternal and health challenges, or run even basic screenings, this is a good opportunity for you. Third is if you're improving access for vulnerable urban, rural, migrant populations. So any kind of intervention, say if you have a mobile health van that goes through slum clusters and provides basic health services. And lastly, here, if you have any kind of referral pathways intervention, so moving from primary health to, say, patient needs a district hospital intervention, if you have any kind of innovative approaches for that. Moving to the next one is mental health. Within that, again, the maximum grant size is 3 crores. First one is that if you're working on preventive mental health care in schools, especially in tier 2 cities, tier 3 cities, for example, a program that trains teachers, schools, headmasters, headmistresses to spot early signs of anxiety in students, bullying related distress. This is a good opportunity. Second is for common mental health conditions. So if your organization is helping people recognize depression or anxiety, reduce stigma around it, or connecting people to, say, counseling. Third is for severe mental health disorders, any kind of models that's looking at combining rehabilitation, long term care, follow up for people suffering from more severe mental health disorders, be it schizophrenia, bipolar disorder, major depressive disorders. This is not an exhaustive list, so please look into your own model and submit that to us. Fourth is if you're integrating, say, mental health into existing community health worker system. So if you have an ASHA worker or an Anganwadi worker who is already visiting households, if you can train her to identify and recognize mental health concerns and refer people appropriately, that would come under that. Next is for elderly care. That is our priority number 2. Within that, the first thing that we're looking at and the main thing we're looking at is if you have models to prevent or respond to elder abuse. So if you have say a helpline or if you have a local support network that can connect these elders to appropriate care or support, it will be a good opportunity for you to apply. Second is if you are working with older adults to give them a sense of purpose, help them stay engaged. Any programs, say, around helping retired teachers volunteer to mentor young students or come together to run a business together, this would be the appropriate bucket for you to apply. Third is if you're supporting the informal caregivers of these elder adults. So if you're helping these caregivers with a program that trains them on caregiving skills, or even connecting them to a group of other caregivers. Fourth is if you have a model or if you want to test a model that looks at affordable community-based dementia care, especially for families who can't afford expensive private facilities in underserved areas, in rural areas. And the last thing is pretty open-ended, but if you have any approach to enable healthy aging, it could be a nutrition intervention or even like a physical activity program, you can apply under this. Priority 3 is for climate and vulnerable livelihoods. So livelihoods, when we say that, it's not open to all interventions of livelihoods. This is specifically to strengthen climate adaptability of vulnerable populations. The first thing is climate resilience for vulnerable urban communities. So say you're looking at migrant workers, urban waste pickers, whose incomes are very connected to climate shocks. So in case of floods or heat waves, their income gets disrupted. So if you can connect them to transition to more weather resilient livelihoods, this would be the bucket. Second is climate resilient rural livelihoods. So if you're looking at, say, any kind of non-farm livelihoods or connecting them to, if they are into agriculture, helping them transition, diversify into drought-resistant crops, this would be the bucket. And the last thing is for coastal and fishing communities. So if you are helping fishing households diversify into any kind of supplementary livelihoods, be it seaweed farming, or ecotourism, this would be a good opportunity for you to apply. And the last bucket that we have is for emerging opportunities. So under that, we have 2 buckets. One is animal welfare and second is arts and culture. For animal welfare, our bigger focus is on community-based human-wildlife coexistence. So if you have any kind of intervention in an area which is frequently affected by leopard violence or, say, elephant violence, and if you can find a community-based intervention to manage that while protecting the wildlife, this would be a good opportunity. For arts and culture, we have 2, which is on strengthening the capacity of public museums. So if you can help a state-run museum digitize, say, its archives, redesign exhibits, pull more people in, make it more engaging, this would be the intervention for you. And second is, I've covered both. So any kind of innovations in public museums, or if you can strengthen their capacity, this would be the intervention. Quickly, just to summarize the key numbers for health is going to be the biggest focus in this portfolio. So across 3 years, you can apply for a total funding of 3 crores. For elderly care, the number remains the same.
Hello.
Hello.
Would you be taking questions now or
I'll let you know. We'll let you know when we take the questions.
Sure, because I want to ask something. Yeah.
Sure. We'll keep the last 30 minutes just for questions. For elderly care, I'll just repeat myself. We have 3 crores reserved for 3 years. For climate and vulnerable livelihood, the cap is 2.25 crores. Again, the duration is the same. It's for up to 3 years. And lastly, if you are looking to apply for animal welfare or for arts and culture, the total grant amount is 75 lakhs for a period of 3 years. We would really request that you apply under one of the portfolios, even if your work is cross-cutting across different areas. And even if you do apply across 2 areas, say health and elderly care. We would request everyone to keep yourself on mute. We will be taking everyone's questions and we hope to address everything in that segment. Yes. Just to end my point, that if you're looking at applying for, say, 2 areas, say health and elderly care, the limit still remains 3 crores. It will not increase to 6 crores for 3 years. So this is the fund, what you can seek funding for. There are these 3 areas. One is if you're looking to implement a program. It can be a new program, it can be an existing intervention. So under the first one, if you're also looking to expand to new geographies, new populations, increase your beneficiary reach, we'll support that. Second is if you have an existing intervention and you want to improve the service delivery. So if you want to change anything, the program design, spend some funding for documentation and knowledge products, or improve staff capacity so that the program becomes sustainable and also replicable. And the last thing is organizational capacity. By that, what we mean is that if you have a bunch of interventions working to benefit a group of underserved population, then you can also seek funding to improve your organizational strength. I will pass it on to Shadan now for the other slides.
Thank you, Tosha. And we are noting down all the questions that you were asking in the chat box as well, but we will proceed to questions once we finish the presentation and at 4:30. Okay. So the key eligibility criteria is the organization has to be registered as a trust, society, or a Section 8 company in India for at least 3 years, because we will request you to have financial statements, audited financial statements for these 3 years as well. They should hold valid 12A and ETG registrations. Audited financial statements, as I've already mentioned, in the last 3 years. While we will not share the recording of the meeting, we will proceed with sharing all the question and answers as well as the presentation in an email to whoever had expressed interest with the form. Of course, like what we're looking at is demonstrated experience in one or more of the priority areas. One of the other key requirement is a minimum of 3 full-time paid staff members, excluding the founders, which would be required for the organization, and they are not currently debarred by any government authority in India from receiving grant funding. So those are the eligibility criteria without which, like you will not be able to apply. In every application, what is the evaluation criteria? The key evaluation criteria includes strong organizational leadership and governance. Governance will also be checked through the questions that we will be asking in the RFP stage as well. A clearly articulated approach to an important problem. How we classify an important problem is basically what you're addressing matters, what you're addressing is unique and very important right now rather than in the long term. Evidence of meaningful outcomes. If you have, this is especially for the category of organizations that are applying to scale their work or replicate their work, that has to be evidence of meaningful outcomes. Or if you're a new organization trying out of an innovative model, the outcomes should be reflective of those. This is one of the most important point, a deep understanding of underserved communities you work with. We're only looking at proposals that work with underserved communities. Now, definitions of underserved while might differ, but like we're going to have a broader lens of underserved communities as well. The ability to strengthen or expand impact over 3 years, demonstrating replicability and scalability, especially very important for the organizations that have very robust models, and a focus on regions and communities from the Northeast or tribal areas as well, right? Like, those are the key regions or areas where we were prioritizing interventions, which are usually underfunded or underserved. Next slide. So for instance, like, we can give you examples of like established evidence-based models. So one of the examples is that if an organization has demonstrated a community-based primary healthcare model in one district, and the organization is looking to support these services in another district, or is trying to strengthen the service quality of the interventions. For new and innovative approaches is like an organization which is introducing a climate resilient livelihood approach, especially in communities which have been affected the most by climate, uh, and are looking to help vulnerable in communities diversify incomes and adapt to climate risk. The grant will support piloting adaptation and evidence generation in this new context. We would request you to please carefully select the options in the EUI, because you would be judged against the other applications in those specific categories and not overall. So each category has a limited funding, so we would be judging you against each of the other organizations in the same funding pool.
Hello.
As you would know, there would be no timeline extensions,
Hello.
unfortunately, for this one, because there has been enough
सर
time.
सर
The
वो
EY
एक काम में
form is
करके
kept
पाँच
it
मिनट
as
पीछे करता है मेरे
short as
साथ
possible, like is
हाँ वो
11:59
ठीक है
p.m.
ठीक है
IST on 4th of August 2026. Post which we will send a request of invitation to submit full proposal, and those would be communicated to the organizations that have been shortlisted. And there is a stipulated date, and we would request all of you to also follow Samita's LinkedIn page, because that is going to be the primary method of communication to the organizations as well. Tosha, can you go to the next slide? Just quickly running through the timelines. The grant call was shared on 20th July 2026. The open webinar is happening on 27th. The submission deadline is 4th of August. The invitation or the selection of organizations and the email is going to go out on 24th August 2026. The final funding decisions will be communicated on 19 October 2026. Tosha, next slide. Okay, now we're going to answer the most frequently asked questions which we have received, and then we are going to take on uh, the answer questions, right? So, what do you mean by underserved populations? Tosha, do you want to take this or should I? Okay, sure. So, what do you mean by underserved communities? Tribal communities, rural and remote communities, urban underserved communities, including slum residents, informal and migrant workers, women and girls, children and adolescents, older adults, especially, of course, for elderly care, persons with disabilities, smallholder farmers, coastal and fishing communities, other populations experiencing significant social, economic, or geographic disadvantage. How many organizations will be selected under each? As I had mentioned, you will be assessed against organizations in your own portfolio. Health, including mental health, will have 8 to 12 grants. Elderly care will have 2 to 4 grants. Climate and vulnerable livelihoods will have 1 to 3 organizations. And emerging opportunities, which were art and culture, will have 1 to 2 organizations. This will be, of course, like, tailored to as many applications we receive. Quick questions. Can early stage organizations, incubators, or accelerators apply? As we had mentioned earlier as well, unfortunately, we are not looking for incubators, accelerators, or for-profit organizations in this current cycle. We're only looking for organizations which have a valid 12A ATG, have 3 years of existence, have financial statements for 3 years of existence. If you don't have current third year audited statements, that's fine. You can submit your financial statements and we can get the audited financial statements. But by the start of the program, you should have audited financial statements. This is specifically for the year 25-26. Okay. Can organizations apply in partnerships or consortiums? Yes. So if you are a very early stage organization which does not have these criteria, and we fully understand that some of these are difficult to get. So we request you to please find a suitable partner, and you can apply in a partnership or as a consortium. However, the grant will be given to the lead applicant, and all the communications and contractual obligations will be managed with the lead application only. So while you can form your internal consortiums, we will be only speaking with the lead applicant. What level of organizational budget and beneficiary reach is typically expected? We have not specified this because the areas that we are currently serving are very diverse. So you could be serving a smaller cohort of 50 people, but your intervention is very robust, or you could be empowering 10,000 people. So those criteria are not there. And we have also set no organizational budget. This is to encourage smaller organizations to also apply for this RFP. Uh, Unfortunately, we will not be funding any research under this grant. This grant is specifically for program implementation and programmatic impact. Organizations which have done research and have come up with an evidence-based approach need to showcase that in the program intervention itself. We are not taking into account any research on this grant application. Hope that is clear. Yeah, go ahead. Can organization, and some of these questions have also come up today, can organizations apply for more than one district or state? Yes, you may apply for one district, one state, multiple districts. Geographic expanse is not a problem. There are there are no geographies that will not be considered. However, we will prioritize, and I'm saying this again, northeast, eastern region. Uh, but you can apply in the areas where you are implementing the programs. Can a proposal span more than one priority area, as was mentioned by Torsha as well? Yes, you may have interconnected themes. You may be working for elderly care, mental health, but please apply to only one major portfolio, which is your most prominent intervention or the most prominent thematic area that is under your program. So, because you will be assessed based on those only. Can an organization submit multiple proposals? No, one organization is only required to submit one proposal. There are no FCRA requirements for this grants because this is a country level role. So this is a specific question for the livelihoods portfolio. Livelihoods will only be considered if they are building on the climate resilience or are like in areas like green jobs, greening of entrepreneurship, etc., specifically for vulnerable rural, urban, coastal, or fishing communities. Uh, are projects outside the stated portfolios eligible? We will not be funding any projects which are not aligned to the thematic and the sub-thematic areas of the projects. Go ahead. What level of detail is expected at the EOI stage? Since it's a Google form, there is a very limited, answers, and there's word limits as well. So you have to select in each of those areas. Uh, you have to describe your innovative approach as and when required in the form. Applications, like how will be the evaluation done? Applications will be assessed based on one of the most important things is alignment to the thematic and sub-thematic areas. Uh, it is about underserved populations. It is about the regions, of course, northeastern region projects will be prioritized. We will also consider the clarity of the proposed approach, evidence, outcomes, organizational leadership and governance, and potential to expand and deepen impact for the application. There is no co-funding or matching contribution expected from the NGO. We have shared the EOI form everywhere, including our LinkedIn, including our website as well. If you are confused, you can go to samhita.org. Tosha, if you could post the link to the EOI in the group chat as well, so that everybody has that. We are not expecting you to find any co-funding or matching contributions for this program. So the early stage organizations are encouraged to specifically apply for this grant cycle. Uh, reporting and monitoring requirements will be communicated to the shortlisted organizations. Uh, we will be giving them some flexibility to adapt activities over the 3 years. This will be communicated to the selected organizations from the EOI stages. The grant size is for the entire grant period. So maximum of 3 crores for health, and for elderly care, a maximum of 2.75 crores for climate, and 0.75 crores
आपको
for
कैसे सिलेक्शन होगा
oh, sorry,
क्या
Tosha,
क्या
did I say the
है
climate one wrong, right?
2.2 crores for climate, yeah.
2.25 crores for climate livelihoods and 0.75 crores for emerging
ईओआई का
priorities.
फर्स्ट स्टेप है अगर ईओआई से हमारा सिलेक्शन होता है
Okay,
तो फिर हमें प्रपोजल
we will stop here. Now we can take questions. First, we will go through all the questions in the chat box, and then we will come
ग्रांट के
to
लिए
the
ग्रांट
questions
चाहिए नहीं
that are there.
चाहिए 2.25 करोड़
2.25
So
crores.
what I do is I can read out the questions on the chat and we can respond. Okay.
Sure.
इसका नाम तोशा
And we will come to you, the raised hands as well. We just want to first go through the questions on the chat. First is when you say climate information services or other locally appropriate adaptation strategies, how do you want to see the livelihood impact?
तोशा
So, how we usually measure livelihood impact is the outcome based approach, which is essentially like increase in income
नॉर्थ
or
ईस्ट हो गया वो
like
उनका
increase
प्रायोरिटी हो गया
in the revenue of an enterprise, or earlier they were like unemployed
दिल्ली में
or did
कौन
not have an employment or did not have any entrepreneurship opportunities. They have some entrepreneurship or employment opportunities. For green livelihoods, this is the same criteria, and this is what we're going to potentially look at. Uh, you can also talk about like if they were earning incomes which were like climate sensitive. So, for instance, any job role or any enterprise that would become redundant in the near future, and that livelihood change is also an acceptable way of applying to the climate and livelihoods subthematic area. Go ahead, Darshan.
Sure. After that, there are a bunch of questions that we have already answered, and we'll also share the PPT. But a key question is, can a consortium apply with all India-based NGO, with an India-based NGO as the lead? Do all the consortium partners need to be India domiciled?
So this grant is going to go to one NGO. The NGO itself may partner with multiple organizations based on the necessary requirements, legal
हमारा
issues,
एनजीओ तो नहीं
etc.,
है ना
etc. The app,
हमारा एनजीओ
the
तो नहीं
grant
है
is only going to go to one NGO partner, and we are going to do the communication with only the lead partner, which is the main NGO. There is no co-partner consortium-led questions in the EUI, if you would have seen. So only one NGO partner can apply.
ओनली एनजीओ
Next one is, does the mental health prevention and well-being have to be for mental health conditions such as anxiety or depression? Or will it also include, say, building resilience, self-esteem, self-image, bullying prevention in schools? So we do have two separate categories. We have one specific category for if you want to do an intervention just to improve mental health of children. And second is for common mental health challenges. So you can apply to either, or you can also do a combination. Shraddha, do you want to?
Yeah, I think that has addressed the question.
All right. How does Samhita assess applications from an Indian Section 8 not-for-profit that is affiliated with an international not-for-profit and draws on its technical expertise while leading implementation in India?
That is perfectly all right. We would be assessing you in comparison to other Indian NGOs as well. That's perfectly all right.
Then we have a lot of questions on the geographic priority. I think Shraddha has mentioned that we are not excluding any geography. So say Delhi, Chennai, Tamil Nadu, all of these you can apply. If you do have operations across multiple states or multiple districts, we would advise you to apply for a program which serves more underserved regions. So, I mean, that is a better way for you to maybe a smarter way for you to actually get the get assessed.
इसका समझ नहीं आया मुझे
I think we have covered questions about turnover, balance sheet. There is no bar Even small organizations can apply as long as you have 3 years of experience. Is 12A, ATG, and FCRA mandatory?
12A and A2G are mandatory for all the organizations that are applying under this grant cycle. FCRA is not mandatory for this particular grant.
Then we have a series of questions. First is, when is implementation expected to begin?
So the final disbursement or final call that you have got to receive the grant will happen in October 2026. Implementation is expected to start right after that. So it could be November or December based on how your implementation model starts.
Second is, under the mental health priority area, government schools are mentioned for preventive care. Is this strictly K-12 or are interventions in undergraduate colleges also applicable?
So in the subthematic area, we have specified that this is a K-12 school level intervention. Colleges in that subthematic area are not applicable. However, if you feel like any of the other thematic areas are fulfilling your criteria, then please apply in that subthematic area. For instance, the fifth thematic area, it's an open-ended subthematic area, which is if you have research pointing out to evidence that a specific mental health issue will be sort of like addressed through it, then please apply through that systematic areas. But if it is explicitly mentioning a population, we would advise you to not apply in that category because you will be held ineligible for this grant.
Next question is on a consortium. If for all the partners, does everyone need to be a non-profit, or can a for-profit organization also be a partner?
As I have mentioned, you need to have a not-for-profit organization that would be leading this, grant receiving mechanism as well. The lead partner needs to have the requisite experience and needs to, adhere to all the requisite requirements under, in the eligibility criteria as well. Uh, if you are partnering with another organization to receive this funding, you may show the experience, a collaborative experience. However, I'm mentioning it again, all the grants are going to go to the lead partner. It is up to the lead partner to disburse it to the consortium partners according to the legal liabilities, legal mechanisms in the country of India. Yeah.
Is there a cap on the number of board members of an organization?
No, there is no cap in terms of the number of board members of an organization.
Can the project program implementation be focused on awareness, education?
Yes. Depending on the subthematic areas, some projects can focus on awareness, but please adhere to the language that is written in the subthematic areas.
We are a new organization and we are awaiting 12G and ATG, and we'll receive it next month. Can we apply while it's pending?
We would urge you to please partner with an organization which has an existing 12A ATG, because not only 12A ATG is required, but also financial statements of the last 3 years are required. So if you are pending approval of 12A ATG, I'm assuming you might not also have audited account statements for the last 3 years. So we would request all of you to, if you are not eligible, you could potentially partner with a lead partner in the same domain area as well. Go ahead, Sasha.
I think we have a lot of repetitive questions. After that, we will be sharing the PPT and we'll also share a list of FAQs. I think we can take questions from people who have raised their hands now.
Sasha, if you can call out their name so that they can unmute themselves. And yes.
I think first we'll go with Ms. Sheila.
Good evening. I'm Sheila Benjamin from an NGO called Scindia in Tamil Nadu. Of course, we do work in 3 states. That's okay, but we are planning to implement this program in, if shortlisted, in Tamil Nadu. Just two main questions I would have clarification on. If in the case we are shortlisted, we are required to submit a full proposal, correct?
Correct. Yes.
With a budget. activities, budget, and all that.
Each year, the
Okay.
budget has to be given. Yes.
Yeah, that's true. Activities and the budget. For that, do you have a template for that?
We do. We will be sharing that with
So
you.
you will be shared.
So for
Okay.
budget as
And I
well as
also, yeah, okay. I'd also like to know in the proposal, would there be space for an administration cost? Administration and program. Of course, programs is there, activities is there, but for the administration, if there is provision for administration, what would be the percentage?
we typically look at a 5% administrative cost.
Okay, all right. All right. Okay. My second question is, uh, any priority, whether it's the first, second, or third priority, in each of these priorities, you have given certain subsections. Like, for instance, priority 3, climate and vulnerable livelihoods. You talk of climate resilience for vulnerable urban communities. Then you talk of climate resilient rural livelihoods, strengthening, and then strengthening climate resilience in coastal and fishing communities. My question is, could we apply, if you're applying under priority 3, could we apply both for climate resilient rural livelihoods and strengthening climate resilience in coastal and fishing communities? It's all under the priority 3.
Absolutely. Absolutely.
It's not
Yeah.
an issue.
So
we-
yeah, if it
we
is
could
a
do that.
stated priority, you can, if you have interventions that serve both, you can.
Yes.
Even for health,
can.
that premises
Okay, thank you.
health, mental health. Yeah.
So it's throughout all 3 priorities, covers all 3 priorities. You can choose 2 or 3, provided you're working in those areas.
Yes.
No, I'm not talking about the different priorities. Under each priority,
Each priority,
2 or
there are multiple themes, sub themes.
yes.
So you can.
one or more you can apply. We can apply for. Thank you so much. Thank you so much.
No problem. Next, we'll take Haley Sung.
Hi, can you hear me?
Yes.
Okay, there is a low network bandwidth. That's why I'm asking. Hi, this is Pranati from Sahili Sangh. Actually, I wanted to ask one thing. Actually, we are working with the sex workers. We are basically placed in Pune, Budwarpet, right? So the thing is, we are included, like we are working with the health, the mental health, and the elderly care also as well, as we are working in HIV/AIDS people, living with HIV/AIDS people who are elderly, like 50 years older than more than that. So can we add all those 3 things into one proposal, or because it's very complicated for us because we are working with the unserved community. You didn't mention in that sex workers are also unserved community, right? So you forget to mention that. So I would love to say that there are so many things we need to work on, because we already did so many surveys and we need to work on the implement and so many what we can call others, so many projects on that, on the basis of the surveys. So can we do that, because health, mental health, and the elderly care is also important for the unserved community sex worker.
Yes.
So
So just quickly clarifying.
yeah.
In the list that we shared of underserved communities, that's not an exhaustive list. You may have, like, for instance, we have left out, like, like sex workers, for instance. There might be other communities as well. SC/ST, Dalit, Adivasi communities. Whatever communities you're serving, please mention that in your proposal. That is completely fine. Your second question, you have to select a priority thematic area. Like, it has to be either health, either elderly care, either climate and livelihoods, or uh, the fourth one, which is emerging opportunities. Emerging opportunities. You cannot apply in all 4 because it will make the evaluation tougher. However, if you are working in like all of these thematic areas, that's fine. You can mention that in your proposal.
Actually, basically, right now, while working and while doing survey, there is a one thing. There are so many important issues are emerging. So that's why I'm asking whether, because elderly care is also important, because those people are not having any like a home or any
We would
they are
request
living
that.
with HIV, right?
Sorry,
Plus, yeah,
I'm
please.
sorry, but like we don't have time for follow-up questions. We
Okay.
would request you to please apply. Like, we would urge you then to apply under elderly care rather than health, if, like, that is your stronghold or population.
Yeah.
Please, we would I'm so sorry, but like we would urge
मना
you to
कर दिया इन
please
लोगों ने
then choose whichever areas
better
that
you
is possible.
could apply
Yeah, thank you.
Prashant,
Yeah.
elderly home में
Next
apply
is from
करो
Anubha
इसलिए
Bhatla.
उनको elderly वालों को ज्यादा
Yes, hi. My question is that if we have submitted an application and suppose we accidentally made an error, so will there be a way for us to clarify on the mistake that we have done, or can we submit it again, mentioning that this is the second one that we're submitting and the first one should not be considered, something like that?
we had not accounted for that. So maybe what you can do is you can write an email to the email ID, and we will look at your case separately. For the second applications, we will let you know, like if you have to apply for a second application. Okay.
All right. Thank you so much.
Thank you.
Next is Kaushal Shah.
Hello, good evening, everybody. My question is, we work with the underserved population that is in Thane Municipal Corporations in Maharashtra. So are we eligible for the application, as you have already mentioned, Northeast? We are, okay. Now, we work in education sector as well as mental health sector. So we work with learning disabilities. And our main is remediation as well as counseling and capacity building of the teachers, municipal school teachers. And we have piloted FLN from last year. It's a blended model along with with the remedial what we do. So are we eligible to go ahead and apply for this Samhita program? This was my question. Yeah, this is my question.
Sure, I can take the first stab at it. I mean, if you can make a very clear, compelling case on how it fits within mental health.
Because the counseling, yeah, so bullying and all.
Absolutely. So in your narrative, just if in your narrative, if you can focus more on that,
Yeah.
I think, of course,
Yeah,
you
so
can.
we just can mention the four verticals, but main is we go with the health, right? The mental health.
Mental health, yeah.
Because that is one of our verticals. The main vertical we started with remedial, and the second is mental health, and then capacity building, and then is fourth is FLN. So we can definitely go right? Yeah.
Yes.
Yeah. Thank you so much.
I just want to quickly address one question. An organization can only apply for only one application will be considered per organization. We would please urge you to not apply or submit multiple applications. That would be like a disqualifier for both of your applications. So we would please urge you to only apply for one application. The second question on the emerging opportunities, there are two subsections. One is uh, animal welfare, where a thematic area, animal-human conflict, has been identified. And the second is arts and culture, where museum restoration and new public museum support has been identified as a subthematic area. Please first apply to the grant application. We will cover most of the costs that a grant could cover in the grant itself, but that's a second stage question. We would urge you to please focus on the EUI first. Yes.
Thank you.
Yeah. Next question, Tosha.
Next. Yes, ma'am. Please go ahead.
Professor GV, you can go
Yeah,
ahead.
we are
Hi.
from hi. Good afternoon, all. I'm out here in Andhra Pradesh. I saw the expression of interest. उसमें attachment डालने के लिए facility is not there. So how do I give you all the three? Like, how do you want the figures in that for the 3 years data?
That's a great question. So please just mention your annual expenditure. We are not asking you to submit your annual audited financial statements yet.
Huh.
All of those will be requested from organizations which are shortlisted, and we will do that in the next stage.
Okay. And another thing is eligibility pay this EOI is doing, or is it an elimination on any other criteria? What is the expectation in your EOI right away?
So first is, of course, the eligibility check. The second is the alignment check. So if you are not falling in the specific areas,
Fair enough.
then you would not be asking. And third is just like a sensitivity and evaluating, in terms of like basic evaluation that this program fits the current narrative. That's all we are checking in the expression of interest. You will be requested to apply for full form if you are considered eligible. Okay.
Thanks. Thank you. Thank you, Deep. Thank you so much.
Okay.
Next, I will
This is Divya from Alert. I have a question.
Sorry. Please, can we go in order? Like, sorry. Just yeah. Tosha, go ahead.
Excuse me.
next I will invite Vatavaran, and then Ms. Divya, you can ask your question.
Can I go?
No. We are inviting Bhagwan I from Vatavaran.
Hi, Torsha, and hi, Shadan. My question is that once the organization is shortlisted or considered, is there any handholding support that we are going to provide during the after the shortlisting?
Sure. So with the shortlisted applications, we're going to provide them with support on in terms of like writing the proposal as well, like helping them. Like we will do a detailed session on how to write the proposal and how to do like all of that submission. We will not be providing hands-on support on the program itself because it would not be possible because it's a very small team. We would love to work on your projects as well. It's a very small team of people, and we also have to keep our admin expenses as less as possible and give away as much of the grant possible to the deserving NGOs.
Thank you so much, Shadan.
I hope that answers questions. Yes, Tosha. You're on mute, Tosha.
Sorry. Next, can we have Divya Hariprasad?
Yeah, thank you. So we are a 20-year-old NGO working in the space of emergency response, training people on emergency response across India. So I just want to know if I will have to apply from one state in specific, or it can be for a broader, implementation across different states. And
So,
if I can apply in healthcare because it is emergency response, meaning training common people in first aid skills like CPR and other activities for life saving.
Sure. Divya, we would encourage you to specify the states and the geographies that you would be implementing this program in, and think about with the requested amount of grant that you are having, like what exactly will be your program interventions or geographic span, etc. While we are also okay with if you want to implement a new curriculum nationwide, because that falls under innovation models as well. So if you go through the eligibility criteria, I think all of these fit into your sections, but we would encourage you to specify geographies as much as possible, and especially underserved geographies.
Sure. Yeah. Thank you. Thank you so much.
Next, can we take a question from Mukula?
Yes, Mukula. Yeah, hi. Am I audible?
Yes.
Mukula,
all right. Okay. So I'm from an NGO that primarily works towards animal welfare. And my question is that another lady right now asked about the 5% administrative expense that can be covered through the grant. We do ask our donors for a 10% project management or a project implementation cost, as well as an AMC, which is basically like a provision to maintain and repair any kind of work that we do towards animal welfare, which comes to up to 15%. Does the grant cover these two aspects, or is there a possibility? Can I understand how that works?
Yeah, as I mentioned, this can be covered. We will look into the specifications of each proposal in terms of what they are doing in terms of cost. Of course, there has to be a sense check in terms of what cost could be covered, what costs couldn't be covered. On the face value, I can say all of this is covered. But we'll get into all of those details in the second stage of this process. Yes.
Okay. Also, if you don't mind, could you please share the correspondence email ID in the chat box?
Yes, we'll share it again.
Cool. Thank you.
I've done that already, but I'll share it once again.
Sure. Thanks. Thanks so much.
No problem. We also have someone named Mukula who has raised their hand. If they're not here.
Yeah, Kopula. Yes.
No.
Yes.
Mukula, yes, but there's also.
Mukula has already answered.
Done.
This was Mukula.
Yes.
Perfect.
Yeah.
Okay. All right. My bad.
Kopula, go ahead.
Next.
Actually, we have
Kopula,
a
go
2
ahead.
year. Yes.
Yeah, go ahead.
We have a Section 8 company, but started 2 years only. We one financial year. Are we eligible? That is my first question. And second one is, we are working for persons with disabilities in health sector also. But we want to produce one documentary for bringing awareness on
parentinghood towards persons with disability, because people feel that they're not fit for a pregnancy or sexual life, that kind of. That is one. Is this project is eligible? And my third question is, I'm also working on incubation programs for persons with disabilities. It's a 12 months program. Myself, I'm running incubator. So can I go either health or livelihood?
Sure. Thank you so much, Kopila, for the question. So let me answer the first question. So unfortunately, in this grant cycle, only organizations who have 3 years financial audited statements are eligible for the program. Kopila, if you have a good program, I would urge you to partner with an organization which has an existence of 3 years and has the fulfills the requisite eligibility criteria. On the second part, like yes, you may apply on the awareness video that you had mentioned. We will ensure there is alignment. If there is alignment, we would consider the grant process. And the third one, I think, on the incubation support on entrepreneurship, etc. I don't think so that is eligible under this, because we have to specifically work on either health, either elderly care, or climate and livelihoods. So that will not be eligible. I hope that answers all your questions.
Yeah, thank you.
Thank you so much. Yes.
Can we take our next
Uh,
question, Niyati?
yes. Yes.
Hello, good evening, everyone. Yeah, my question is related to the museum aspect of the grant. That so we work with a lot of World Heritage sites. So my concern was that do we just have to do something for existing museum, or can we also plan of in creating an interpretation center for a World Heritage site, or maybe a monument of state importance? Can we do something like that?
While we would encourage you to also partner with a public museum or a state affiliated museum, we see the importance of working with heritage sites and that component as well. So you can apply, yes. We would then assess all the applications, and depending on if your application is a project that we could consider, because there's a strong alignment on public sector museums and public sector heritage sites, so we could consider that application.
Oh,
Okay. However, setting up a
Hello.
new museum would not be currently in this scope of work. Yeah.
oh, all right. Thank you.
Thank you, Niyati.
Hello.
Can we take the next question from
Hello.
we can hear you,
Hello.
but we'll invite you to speak, Mr. Reza. Next question can we take from Anshu?
Yeah, hi. My question is that since during your brief you mentioned under the climate and climate part that it is for transition of the vulnerable group to the employment where they are least affected or impacted by the climate, or any sort of impact through the climate. So is it only for the transition, or it also support the climate resilience programs, like doing any intervention in the informal communities or with the people who are impacted on the resilience part? Does that also
Yeah.
included, or just the transition?
So building resilience for climate resilient climate affected communities is a part of the EOI. So you can apply definitely.
We can include that part.
Yes.
Oh,
Yes.
thank you.
Definitely. Thank you, Anshul.
Can we take the next question from Dr. Bharati Patil, Aadhar Sanstha?
Hello.
Yes, ma'am. We can hear
Hello.
you.
I'm audible?
Yes, you are.
Yes, ma'am. I'm asking about that. We are working for the tribal mother in the borderline of MP and Maharashtra border for maternal health. Can we apply for continuous this project, because John Hopkins funding is going stop few months back. So we want to continue the services for the mothers in very
Yes,
remote
Dr.
tribal areas.
Dr. Bharti, definitely these are the kind of projects we are also looking at. We are looking for underserved populations in underserved regions of the country. So please apply. We would really urge you to apply. You are eligible to apply.
Okay. Thank you.
Thank you.
Can we take the next question from Dr. Sapna K?
Hello.
Yes, we can hear
Yes,
you.
Dr. Singh.
Yeah, hi, good evening, everyone. Can you hear me?
Yes.
Yeah. I'm Dr. Sapna from Aditya Birla Education Trust. We are working in the space of education, mental health, and menstrual health, and we would like to apply under the category of mental health. You mentioned that mental health is one of the subcategories under health, and under mental health, again, there are four categories that you have mentioned. Preventive, one is preventive, second is community based, third is scalable models, and so on and so forth. What I wanted to ask is, so under mental health, can we apply under all the four subcategories, or we have to stick to any one, or there could
You can
be an
apply.
overall?
There can be an overlap in the subthematic areas. Overlap is possible. You can apply under all four. That's fine.
That is fine. But then again, what you have highlighted is there should be only one application per organization.
Yes.
So if you want to apply under any category, whether it's health or any under theme, we have to choose only one. And
Only
under
one.
that, under health, if you want to go for mental health, then we can club these subcategories together, depending
Yes.
on our area of work and the
Yes.
impact so far.
Definitely.
Thank you so much.
Thank you. Can we take the next question from Raisa Chaudhary?
Yeah, hi, good evening. Just a quick check. The mental health category is something that's been well explained. Still, I wanted to just have a top up on this. Does mobility disabilities also come under the health section? I understand there are subcategories, and then just in case if there is a resonance, that can be taken care of. But then, just for this particular portion, that is mobility disability also kind of eligible for this for the category under health or not?
So, to answer your question very quickly, in the area of health, we're not looking at any specific health area. So, it's not NCD focused or maternal or child health focused.
Right.
As long as it fits into any of the four sub themes that we have.
Right.
And if you see a good fit, please, you can feel free to apply.
All right. Understood. Thank you so much. Thank you.
Just want to take a quick question from the chat as well. Organizations that are primarily working in livelihoods, but are not working in communities impacted by climate, are not eligible because none of the four areas that we are sort of working on are applicable for this particular grant. Samhita CGF also takes out a lot of other RFPs. We request you to please follow our LinkedIn page and visit our website from time to time to get to know of any other uh, like you know uh, such opportunities. This is a domestic funding and that is why we are not asking for an FCRA certificate. So this is domestic funding. Now the next question, please.
So we are almost at time. We'll take two more questions, and I know a lot of people have their hands raised. So please write to us. I have left the email ID. Write to us, and we'll respond to all of you. But in the meantime, can we take Apurva Gupta's question, IIC?
Hi, I wanted to check. So IIC is a fellowship organization. We are housed under University of Chicago Trust. Is that the kind of a model which aligns with you when it comes to funding?
Unfortunately, Apurva, unless IIC is registered as a Section 8 company or a trust or a society, we will not be able to give
Oh, it
you
is. Yeah, it
you
is.
would
It
be
is. It is a non-profit organization.
okay.
So
Then you are eligible to apply.
yes,
Then if you
but I
have a
wanted to check
project,
like if a fellowship model is something which works.
we'll have to check. I think
Okay.
it should be okay unless it is not aligned to any of the subthematic areas. So if a fellowship where the fellows are particularly, for instance, working for
Yes.
mental health of school children, yes, the applicability is there. But if the fellowship is a broader construct of just funding the fellowship in itself, I don't think so that is eligible. I
All
hope
right,
that answers
sure.
the question.
Yeah, that definitely answers. Thank you.
Yes.
Thank
I
you.
think
We'll
we
take
can,
one.
yeah, we can, Tosha, I think we can take 5 to 7 more minutes, and then we can close out, so that we answer as many questions as possible. But please ask only unique questions. If your questions have also already been asked, please give the chances to other people. And, if you can remove your raised hand if your question has been asked already. Yeah, Tosha, go ahead. Sorry.
Yeah, so we'll take the question from Kinjal Pillai from TUL Foundation.
Yeah, so my question was related to, I had two questions. One is, under the health sector, can we cover road accidents in children where children are being affected, and if that can be protected? Is that eligible for application?
Unless, Kinjal, your model also specifically targets primary health care or
Yes.
responding to the mechanism, I think then yes. If it's specifically on road accidents and awareness building, I don't think so that's eligible under this program. So that
Okay.
is the answer. Yeah.
And I also had another question stating that the climate vulnerability of the heat stress and floods, they affect a lot of migrant workers and their living conditions are really bad, which affects their productivity. If their living conditions are improved, for example, the construction workers, is that eligible to prepare a guidelines or kind of applicable norms for them which will improve their livability? Is that applicable?
Yes. 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 Yes.
Thank
So
you.
building climate resilience that specifically affect their livelihoods or builds their livelihoods is both eligible.
Okay. Thank you. Thank you so much.
Thank you. We'll take the next question from Janvi.
Hi, good evening. So my question was, I'm from Bhavishya Bharat. So we are working in the Sikkim since 2008. So we are mainly focused on MOPDs. We'll be having the vehicle, we'll be going for the tribal areas and we'll do service there and we'll get that. And third project we have in the Sikkim is Spring Shed Management also. Do we have specific locations in Northeast or can we work in Sikkim also same?
Please apply to wherever you want to apply and wherever you feel the implementation model is the strongest and where your NGO can make an impact.
Other question was we can implement TB till now we don't have TB TB services in the Sikkim. So can we apply that?
Yes.
That's
Please go
not
ahead.
so because we
Yes.
did not even start the TB project in the Sikkim. So we would like to
Yes.
start the TB project in
Yes.
we have suppose we have
Janvi,
the yes,
I would urge you to please give a chance to other people as well.
sure.
You are eligible. Please apply. Okay.
Next is Preeti Sundarajan.
Hi, I just wanted to check if you fund organizations working in action research, where there's some amount of research involved, but the focus is on implementation of the intervention.
So the grant will only specifically fund the implementation of the model and not the research. Because with research, there are additional responsibilities that we would have to take. And unfortunately, in the scope of work, we do not have those right now.
Got it. Thank you.
Can we have the next question from Yash?
Yeah, hi. So for the health hermetic area, if we apply under access to health, so is it important to include a mental health component in it or a primary healthcare initiative such as MMU or other healthcare programs are eligible? And the second
Yeah.
question is under climate resilience, is it EV and solar scale training program for rural women would be considered as green job and can we apply for that?
The second question is a yes. The first question, please check the subthematic areas. And unless you have an aligned project, we would request you to not apply for the grant. Yes.
Okay,
Okay.
so any kind of awareness screening of giving the referral pathway programs won't be eligible, like anemia screening or kind
That
of.
is eligible. That's why I'm saying please go through the detailed subthematic areas. These
Okay,
questions are answered in the subthematic areas.
okay, works. Thanks.
Yeah.
And the EV one we can apply, right? Even
Yes.
yes, you can.
Yes.
Yes, thanks.
Can we take the next question from Reza?
Hi, thank you so much. I'm just waiting for a long time. Hello, am I audible?
You are audible. Yes, sir. Go ahead.
Yes. So the thing is that we are actually working in healthcare, particularly with children born with cleft. In Eastern India, and we are trying to expand it to Northeastern India. Our organization is registered in Assam from the Northeast. My only question is, we have been eligible for all the thing, like we have all the documentation and audited financial report. The thing is that we do not have employee. So three of our board members have been actively working. We do not take any money as of now from the organization. That's how we keep 99% of the amount goes to our prompt. So will we be eligible to apply since we do not have any employee?
Unfortunately, since we've put this constraint on everybody, I think like your application would be deemed unfit for further processing. However, if these circumstances change, we would inform you and would send out an email to everybody, because if we change any eligible criteria, we would have to go through our board approval as well, and a specific case has to be made. And unfortunately, that is looking at not possible at this stage.
Okay. Okay. Thank you so much.
Okay. Thank you so much, Rizwan.
I think we can take the last one question from Suyasha, and then we can close this session.
Yes.
Suyasha S. Carers Worldwide India.
Hello. Hi. Can you hear me?
Yes.
This is Navya from Wiser Foundation. So I have a question. Like, we are an organization who works in women empowerment, innovation, and skilling related areas. So are we eligible to apply for this grant?
I have already answered this question. Like, livelihood organizations are specifically not eligible for this call unless you're working in
Okay.
climate resilience livelihoods.
Oh, thank you.
So Yasha, you were not audible. Could you ask your question?
Meanwhile, can I go, please?
Sure, go ahead, Sharon.
Hi. Does sports-based intervention in government school be considered an intervention for physical and mental health?
So Shani, if like the intervention we are particularly doing is impacting mental health, and there is evidence that mental health is improved by that particular
Mhm.
sports activity, then
Mhm.
yes. If we would unless there is strong alignment, we would urge you to not then apply for this specific intervention.
Okay. And does an organization have to have a funded project in the past to be able to
No,
apply in that particular thematic?
no.
Okay. Thank you so much.
Okay. I think we'll now have to close out this webinar because we've answered as much patience as possible all the queries. We would urge you to please include the question. So yes, sir, we couldn't hear you, unfortunately. We would urge you to write to us at the email address. We will try to answer those queries. We will shortly release. Please wait for further queries. Please wait till Thursday. We will be releasing all the queries that you've asked in this webinar, plus all the queries that you've been showcased to everyone, so that it answers most of your questions. If after Thursday any other further queries are required, please write to us on Friday, and we will try to respond to you then. Does I hope everybody is all the queries are addressed, and we try to do it as much as possible.
We know
Thank you
we
so
missed a
much.
bunch of questions from a lot of you. Please write to us, and we are very proactive on that email ID. We'll respond to you as quickly as possible.
Please share your email ID.
Can you send us PPT
The
that
Yes,
we
PPT
have
will
yeah.
be shared with you. Another FAQ document, like Shadan said, that will also be shared with you. I have left the email ID a couple of times. If you want, we can
Yeah,
just repeat it. It is cgfgrants@samhita,
fine. Thank you. Thanks a lot.
cgfgrants@samhita.org.
Can you share us recording?
The recording, unfortunately, will not be shared, but we'll take a documentation of all the questions that were discussed in the open floor also, and we'll add that to the FAQ list.
Yeah, because unfortunately for the sharing of recording, we will have to take consent of everybody, which we did not take. And since consent is required, we will not be sharing this recording with everybody.
Thank you so much,
Okay.
everyone,
Thank you.
for joining.
Thank you,
Thank you.
everybody.
Forward your applications. 4th August, that's the deadline. Please adhere to that.
Thank
Thank you
you.
so much.
Thank you
so
so much,
much.
Jay.
Thank you
Thank you so
so
much.
much.
Thank you, Shubham.
All the best.
Thank you very
Thank
much.
you.
Sir.
Thank
Yes.
Thank you.
you.
Thank you.